Hello, I am Dr. Zhou Jingyi. A serious warning has been issued regarding our collective future, one that demands our immediate attention and a deep understanding of the scientific data released by international health organizations. The International Agency for Research on Cancer, a specialized agency of the World Health Organization, has released a comprehensive projection that outlines a significant and concerning shift in the global cancer burden. By the year 2050, it is predicted that the number of new cancer cases worldwide will reach approximately 35 million annually. This is a dramatic 77% increase from the estimated 20 million cases recorded in 2022. Statistically, this equates to one person being newly diagnosed with cancer every 4.5 minutes. This projection highlights a future where cancer touches our lives more closely than ever before, requiring proactive global health strategies. Why is the number of cancer patients surging to such an extent? Today, we will examine the structural factors and economic challenges behind these figures, grounded in the latest research from Nature, Science, and The Lancet. The rapid increase in patients is driven by two primary structural factors. The first is demographic change. Global population growth and the significant aging of the population are the most influential drivers of this trend. Think of cellular division like a high-speed copier. Over time, as we age and life expectancy increases, the copier begins to produce more errors. Since cancer risk rises with the accumulation of these errors, a larger elderly population naturally leads to more cases. The second factor involves shifts in risk factors accompanying modern development. Changes in diet, activity levels, and environment are creating new oncology risks globally, as identified in recent IARC reports and Lancet oncology studies. Tobacco and alcohol remain major contributors. Tobacco continues to be a leading cause of preventable cancer deaths worldwide, while shifting alcohol consumption patterns in emerging economies are creating new public health challenges. Obesity, or high BMI, acts like heavy apps slowing down your body's operating system. The westernization of diets and a decrease in physical activity accompanying economic growth have linked obesity to increased risks for several major cancer types. Furthermore, air pollution caused by rapid industrialization has become a modern risk factor that cannot be ignored. The IARC classifies outdoor air pollution and particulate matter as Group 1 carcinogens, directly impacting lung cancer rates globally. The World Health Organization is sounding its strongest alarm regarding economic inequality. These projections reveal a cruel reality. The wealth of a nation and its HDI directly determine the survival chances of its citizens. In developed nations with a high Human Development Index, survival rates remain relatively high. This is due to established medical infrastructure, widespread early detection systems, and access to the latest pharmaceutical advancements from journals like NEJM. However, in low-income countries, the situation is vastly different. Projections indicate that cancer mortality rates in these regions will nearly double by 2050 due to a lack of basic diagnostic tools and affordable treatments. Consider breast cancer. In countries with a very high Human Development Index, the 5-year survival rate exceeds 85%. In stark contrast, women in low-index countries face survival rates below 40%, illustrating a massive gap in accessible care. Delayed diagnosis and limited access to expensive state-of-the-art treatments, such as immunotherapy or targeted molecular therapies, are critical factors. The disparity in benefit from medical technology is set to worsen as we approach 2050. While the projections are sobering, there is a significant source of hope. WHO data indicates that approximately 40% of all cancer cases can be prevented by eliminating avoidable risk factors through proactive measures. Prevention includes individual actions, quitting tobacco, moderating alcohol, and maintaining a balanced diet. Science shows that weight management through exercise significantly reduces inflammation and cancer risk, potentially altering our biological trajectory. Vaccinations are also highly effective tools. The HPV vaccine for cervical cancer and hepatitis vaccines for liver cancer are proven strategies that can save millions of lives if implemented globally and equitably. Reliability in our approach comes from staying updated with journals like Nature, Science, JAMA, NEJM, and The Lancet. These sources provide the data needed to build effective public health responses and structural systems. However, individual effort is only part of the solution. We need structural initiatives to reduce air pollution and build social systems that ensure equal access to screening and treatment for every individual, regardless of their geography. The figure of 35 million people by 2050 is not a set-in-stone future. It is a projection based on current trends. We have the power to change this number depending on the society we choose to build starting today. We need accurate knowledge and concrete action now to address the challenges of the future. Please note that individual results and risks may vary due to biological differences, such as gut microbiota or genetic predispositions. Thank you for watching. If you found this information helpful, please subscribe and give us a like. We must work together for a healthier 2050. Goodbye, Zaijian.